You know, every department has got its own language, so pharmacology is not an exception. Pharmacology has got its own terminologies, which we are, once we learn it now, we'll just be meeting it as we go on. Then after that, we are going to also talk about the classification of drugs. Then we'll be done with the lecture. I hope we are going to manage to do all this today. Okay, so just a little bit about the introductory part of pharmacology. As we all know, whenever we hear the word pharmacology, I'm sure there is something that clicks in our mind. Usually it's something that has to do with drugs. Yeah, I know most of us know about that. When once we hear someone talk about the pharmacy, someone talks about the pharmacology, yeah, some things click in our mind as something which has to do with the drug. So in our introductory part, we are saying pharmacology is just the study of pharmaceutical sciences, which is concerned with the study of the interaction of chemicals, which is actually these chemicals we are talking about, just like I said earlier, these are drugs. And these drugs exert biochemical or physiological effects on cells, tissues, organs, or just the whole organism function. Again, for me, I would define pharmacology as the. I would define pharmacology. Let me put it in three terms. I would define pharmacology as a study of number one. You should, if you have somewhere to write, you can write this. Number one, as the study of drug. Number two, as the study of the effect of the drug on the body. And number three, as the body's response to drug. So I said, number one, pharmacology is the study of a drug. Number two, the effect of a drug on the body. Number three, as the response of the body to the drug. So that is the definition of pharmacology in three terms. Now, we need to understand these same three terms that we've talked about. Let me just show you. I think I put it somewhere in the introductory part. Yeah. So we also need to understand this same pharmacology that it comes from two words. There is pharmacon, which simply means a drug. There is also uh, logos, which simply means a study. I'm sure we are all aware of this. So this is the definition that I gave earlier to say pharmacology is all about the study of number one, this is drugs. Number two, drugs effect on the body, and number three, the body's response to drug. So we need to understand what a drug is. We also need to understand how the body, once you take that drug, how is the body going to respond? And that drug which has entered your body, what is it that it is going to do in the body? So those are some of the things that we are really going to focus on. So this one is simply this part is simply talking about what we've talked about, like the physical and chemical properties of drugs. These we need to really understand them, we need to know them, and then the biochemical and physiological effects of drugs. These ones, especially the physiological effect of drugs, like once you take a drug, what are the effects that it is going to have on your body? Take for instance, some people will say, if I take this drug, I'm going to have lashes. Those are some side effects of a drug. And some people will be like, no, if I take these drugs, maybe I'll vomit. Yeah, so those are some of the physiological effects of drugs. So this knowledge of the history, source, and use of drugs, yeah, like I said, we are also going to look at the history of drugs, how these drugs came about. Also, we need to understand the sources of drugs, because you cannot just, for the sake of the manufacturers cannot just get anything and mix to make a drug. What if it's a poison that they are going to make and then it's going to kill people? So That's why it's important to know the source of drugs. That's why even when you buy a drug, you are going to find a manual where you have things like uh, some of the things they used to make that same drug. So that paper is important. For some of you people who just throw it and they never read it, it's important. As a person who studied pharmacology, you need to pay attention to those things. They are important. Then drug absorption, distribution, metabolism, and excretion. These ones we didn't need to understand them. Uh, we need to know once you take a drug, uh, how is the movement of that drug? How is it going to be distributed to the organs and the tissues of the body? Then once its work is done in the body, what happens to the drug? It's going to be removed from the body, and that's where excretion comes in. So these ones, one, two, three, the ADM, we are going to study them under pharmacokinetics. I'm sure that one will be our next topic once we are done with the introductory part of pharmacology. Then moving on, we are looking at the history, of pharmacology. Just like I said, there might be some of you are so much interested in knowing how drugs came about, the father of pharmacology, things like that. I'm sure there are people who might be interested in knowing that, but for the sake of this lecture, we are really not going to focus much on the history. And looking at time, we should look at something which is important. I know, yeah, the history is important. You really need to know how things came about. But for the sake of this lecture, like I said, let's not focus on the history. Maybe you might want to know the father of history. This is also that name. Some of us who are from northern province cannot pronounce. So you you'll get to know that this is Oswald, the father of pharmacology, modern pharmacology. Yeah, you read about it. It's in the history. So let's look at a drug. So in my definition, I'd put three things, and one of the things that I'd put there is a drug. So what is a drug? You need to know what a drug is. So in our definition, it's saying a drug is just any chemical that affects the process of a living organism. It affects the process of a living organism. Take for instance, if you take a drug, let me get paracetamol as an example. If you buy paracetamol, you take it in. Uh, Take for instance, you have an headache, so you take paracetamol to relieve that headache. So now this paracetamol is what we are calling a chemical. Paracetamol is a chemical. So once it enters your body, it's going to change one or two things in the mechanism of how your body is, and then it's going to produce either a desirable effect or undesirable effect. So now you need to ask yourself when you are taking a drug, why am I taking this drug? Is it because, and mostly why the main reason we take drug is to have a desirable effect, not undesirable effect. So a desirable effect can be you want to relieve that pain. Now, in a case where you take a drug like paracetamol and then it gives you undesirable effect, by undesirable effect, it may be side effects like vomiting, maybe rashes, or maybe just an organ failure. Those are some of undesirable effects that a drug can cause to you. But you did not intend to take that drug so that you can have an organ failure. That was not your desire. Your desire was to get healed, things like that. But then the drug that you took has caused an organ failure. So in this case, we can say that chemical which you took, in as much as you saw it as a drug, it may be poisonous, and we can call that one as a poison. So that's why they even say a drug can be both a poison, it can also be a drug. like in the case of this same example I gave, paracetamol, it's at the clinic they tell you that take one in the morning, take two in the afternoon, or let's say take two in the morning, take two also in the afternoon and in the evening. Then you see that no, I'm not getting better as fast as you want to get ill. And then you decide yourself that no, I'm going to take maybe 10 paracetamol in the morning. Again, I'm going to take another 10 in the afternoon. You realize that it is going to produce undesirable effect because you have that is an overdose. That is not what they told you, and that is the dosage is just way too much for your body. So it's going to produce undesirable effect, and we are going to call it a poison instead of, in as much as it is a drug, it is supposed to heal you. It's going to produce undesirable effect, and you're asked to define what a drug is. I know it's so simple to define a drug as a chemical that affects the process of a living organism and you end there. But for you to get formats, I would recommend that you get used with the WHO definition of a drug, which is defined as any substance or product that is used or is intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. So you, as the one receiving the drug, you need to benefit from it. If you don't benefit from it, then it's going to be poisonous to you. So that's the key point. Please get used with the definition that is defined by the WHO. Whenever you're giving definitions, always give definitions that are defined by the WHO instead of just defining a chemical that affects the process of a living organism. Because that one, you won't be able to get full marks. I hope we are together. Kindly, I'm not seeing if I'm out of the meeting or not. So you should be reminding me if I am still in the meeting. Hello? Hello?
We are still in the meeting.
I still in the meeting. I can hear you.
All right. Thank you very much. So we are moving now to the sources of drugs. Remember what we said earlier. You need to know whenever you are prescribing a drug for someone, know the content of a drug. Mukapera poison ku bantu. So you need to know what are the contents of this drug, what is it made of, and what is the main ingredient of this drug. Where did it come from? Those are some of the questions that you should be asking yourself. So there are some different sources of drugs, as we all know. Usually, traditionally, drugs comes from plants. That we all know. Even a child knows that there are some plants where they get drugs from. So even at home, maybe now Waramala, they will tell you, okay, let's make this concoction. We are going to mix this and this. Then we are going to warm it up, maybe for some time. Then we are going to drink like that. So those are some of examples that I can give for the drugs that comes from plants. So in this same drugs that come from plants, we are saying some they will come from alkaloids, some will come from glycosides. So those that come from alkaloids, we have examples. Please, you need to know these examples because they do pop up in MCQ questions. So we should get familiar with them. So let's say in plants, we are saying this source plant as a source of drugs. We have an example which is morphine and atropine, quinine, diazepam, ephedrine. So these ones are coming from plants, but specifically from alkaloids. Then we have glycosides, where we have digoxin. This is an example of glycosides, and glycosides it's under plants. Then again, apart from plants, uh, you can get uh, drugs from animals. For example, a common example is insulin. Insulin, we all know that insulin comes from animals. Insulin comes from animals. So this is an example you can give on animals as the source of drugs. Then minerals, this one also we know it's actually a common one. For example, ferrous sulfate and magnesium sulfate. These ones are minerals. So minerals can also be a source of drugs. Microorganism. We know that there are some microorganisms that can act as the drugs, though some microorganisms can be dangerous uh, to our bodies. They can also be helpful to our body. They can act as a medicine. So uh, things like penicillin, streptomycin, these are some of the examples of microorganisms that can be of benefit to our bodies. Then uh, we all know that there are drugs that are just manufactured, those that we call synthetic drugs. Remember last year in organic chemistry, we is it aspirin that we were preparing. So that one we can say it's a type of source that is falling under synthetic drugs because we were getting is it alcohol and some other things, then we synthesized a drug, and that drug we called it as aspirin. I've forgotten the other name, some of you can remember. Yeah, so those are synthetic drugs, and some of the example is aspirin, and the one you are told to draw in the exam last year, paracetamol, which most of us failed. Yeah, so those are some of synthetic drugs. Any, I'm sure I talked about this already, medicine, or you can say drug versus poison. So, like I said, in case some people have just joined, like I said, if a drug does not produce a desirable effect on your body, once you take it, it gives you rash. Once you take it, you vomit. Once you take it, maybe it causes an organ failure. We can't call that one as a medicine or a drug because it has now changed. It becomes a poison. It becomes poisonous to your body. So it does not help your body in any way. It doesn't help you. Like in the definition that WHO has given, at the end you saw that a recipient has to benefit from it. Now, if you as the recipient is not benefiting from it, it does not qualify to be called a drug. That one is going to be a poison. It is now called a poison. So like this is the statement, I mentioned this statement earlier that the same chemical can be a medicine and a poison. It depends on condition of use and the person using. So on condition of use, I mentioned this one to say, if you take overdose, paracetamol, you take it overdose, definitely you are not going to be okay. It's going to affect you because that is not the normal dosage that you are supposed to take. I'm sure this one is very much clear and well explained. We move to, like I told you earlier, every department has got its own language, and the pharmacology is not an exception. So all of us, you may find maybe in pharmacology has got essay parts. We never know. You may find maybe they just ask you to define these same terms that we are going to look at today. So it's important for us to get familiar with the terms that are used in pharmacology. So this is now what we are starting right now. So the first term is pharmacokinetics, and this one is going to be our next topic, probably next week, if I'm not mistaken. So pharmacokinetics it's a word which is made up of two words. We have the first one, pharmacon, and the next one, kinetics, or we can say kinesis. I'm sure you saw At first, from the definition where we had splitted pharmacology into two, the first word was pharmacon. Even this one, pharmacokinetics, we can say there is pharmacon, there is also pharmacon, there is also kinesis. So this one, kinesis, I know all of us knows what kinesis means. Kinesis simply means movement. In pharmacon, we said earlier that it's a drug. So in simple words, we can say pharmacokinetics is just the movement of drugs in the body. So by movement, how does the drug now move in the body? So that is what will be our main concern. We are going to look at it. Once you administer a drug to someone, they ingest the drug, let's say orally, and then that drug, what will happen once it reaches in the stomach, the intestines? Obviously, the drug is going to be absorbed because for it to start working, it has to be in the bloodstream. So that's where the ADME is coming in. This ADME, the A simply means absorption, the D is distribution, M, this is metabolism, and E is excretion. So the drug, once it gets in the body, it has to be absorbed, distributed, then metabolized, and finally be excreted because its work now is done in the body. So it has to be removed from the system. So that is just about pharmacokinetics. We are going to get to know more about it once we start pharmacokinetics as a topic on its own. Then from there, the next terminology we should be familiar with is pharmacodynamics. So pharmacodynamics is also, just like pharmacokinetics, is also made up of two words, which is pharmacon. Pharmacon, I'm sure by now, we've been mentioning it several times. I'm sure by now you are familiar with it. It's simply a drug. Then dynamic is simply the power. So if we coin these two words together, we're simply going to say this is the power of the drug. Once you ingest that drug, what is it that is going to happen to your body? What will be the response of the body? So this is now where we are going to look at the physiological effects on the drug on your body. So that is what we are going to focus on, like the side effects of a drug. If, for instance, you take paracetamol in your body, what will be the side effects of that drug on your body? It's very important to know. By the way, whenever you are studying the drugs, it's important for you to pay attention to the side effects. I know most of us will go for the most common three, which is vomiting, diarrhea, and rashes, things like that. So whenever you are studying about a drug, make sure you familiarize yourself with the side effects, and that is where pharmacodynamics is coming in. This pharmacodynamic is also going to be a topic. We are going to do it in detail. Yeah. So we continue by saying physiological and biochemical effects of drugs and their mechanism of action at system, organ, tissue, cellular. I've talked about this already. So maybe one thing which I did not mention when you are studying drugs is that you need to know their mechanism of action because there are some questions where, especially in essays they'll ask you, name the class of this drug, and things like that. Then they'll ask you the mechanism of action for that drug. So you need to pay much attention to that. It's very much important. Then pharmacotherapeutics is our third terminology. So therapeutics is simply treatment of diseases. Simply the treatment of diseases. It's as simple as that. So the application of pharmacological information together with knowledge of disease for its prevention, mitigation, or cure. So first thing you need to do, you need to diagnose a disease. After that, then you need to, that's when you can know what drug you can give to someone. If at all you know the condition they have and their maybe, let's say, how can I put this one? Okay, if you know about a disease, that's when you can prescribe a drug that a person can take. Otherwise, if you don't know, you might give a wrong drug to a patient. So it's very much important that you understand the condition and also the drug that you can give to the patient. All right, so we move on. Pharmacognosy. I'm sure we've even talked about this already when we're talking about the sources of drugs. So pharmacognosy is just the study of medicinal plants and other natural substances as sources of drugs. Yarama concoction mupanga yadi. No, I have a flu. I want to make it. I want to get the onion. I want to get what mix boil, and I drink. So that one we can get in pharmacognos because this one is simply the study of medicinal plants. And the area we said that most of our medicines or most of drugs comes from plants as the source, where we had the alkaloids and the other one, which is glycosides. And then this is simply the definition of pharmacognosy. For our friends who are doing pharmacy, they do pharmacognosy as a course on its own. But for us, maybe as we go on. But for now, just know its a definition. Then from there, we need to look at clinical pharmacology. We need to look at clinical pharmacology. So clinical pharmacology is simply the scientific study of drugs, both old and new in man. It includes pharmacodynamics and pharmacokinetics. I'm sure by now you are very much familiar with the pharmacodynamics and the pharmacokinetics. This is the drug power, and this is just the movement of a drug in your body. So investigations in health volunteers and in patients, evaluation of efficacy and safety of drugs, and the comparative trials with other forms of treatment. So the most important thing that I want you to pay much attention on is the aim. What is the aim of clinical pharmacology? So its aim is just to generate data for optimum use of drugs and the practice of evidence-based medicine. By evidence-based medicine, they simply mean, take for instance, if a certain company they produce drugs and then that drug which they produce, uh, they supply it and then they start giving it to people. Now, take for instance, if a person has taken that drug, maybe let's say three-quarters of the people who took the same drug has been affected. Maybe some people have got organ failure, things like that. Some people maybe just some other side effects which are unreasonable. They have to find evidence to track that manufacturer who created the or who manufactured that's very drug. So this clinical pharmacology is important in terms of that scenario because it helps us to locate the people who actually manufactured that same drug. Not much to talk about that. So clinical pharmacology focuses on this. This is, I think I've talked about some of these. Pharmacodynamics and pharmacokinetics. So it will focus on the movement of a drug. It will also focus on the pharmacotherapy. We all know what therapy is. Yeah, things like that. These are some of the things that you can just read while you are studying. Yeah. From there, toxicology. I'm sure it's even the word itself is self-explanatory. So this is just the study of poisons. Like I've talked about a poison, what it is, and it's the one. Even I even mentioned to say a drug can be a poison also once it creates undesirable effect on your body. Yeah, things like that. So toxicology, I'm sure you can really know how to go about it and you can define it. This one. Okay, so from here we move to chemotherapy. So chemotherapy is simply the treatment of systemic infection. Okay, let me just put it in short. Chemotherapy is just also the treatment of diseases, but what type of diseases? Take for instance, if we talk of cancer, it's not it's not every condition that we can use where we can use chemotherapy because uh, I've put an example here. it is used to kill fast growing cells in your body. So fast growing cells, let's say your cell has been affected, then it's growing as fast as possible. So for you to get to kill those bacteria that are affecting those same cells, you need to go for a faster route. Instead of using just these normal drugs, it's better use chemotherapy to kill those fast growing cells in your body. So they advise to undergo chemotherapy so that those cells can be killed. Mostly for those people who are having cancer, tumors, things like that. That's when you'll find that no, they're using chemotherapy because cancer cells are fast growing, same as the tumor cells. Those ones that they grow as fast as possible. Yeah, so you use chemotherapy. So now you need to we are saying drugs in general may thus be, it may be pharmacodynamic agents or chemotherapeutic agents. Pharmacodynamic agents, these ones are designed to have pharmacodynamic effects in the recipient. And we understand what pharmacodynamic is. We defined it earlier as the power of the drug. Uh, yeah, the power of the drug on your body. So how your body is going to respond to the drug. Is it going to give you side effects such as vomiting? Is it going to give you side effects such as rashes? Or maybe is it going to kill your organs? So those are some of the things that to look at. Though we will not go much in detail in terms of pharmacodynamic agents, because this is just an introductory part. We are just getting familiar with the terms that are used in pharmacology. Then as we go on, we are really going to get used with them. We are going to meet them as many times as possible. Sure. Then we have chemotherapeutic agents, which are designed to inhibit or kill invading parasites, malignant cells, and have minimal or no pharmacodynamic effect in this recipient. So for these ones, usually they I talked about the side effects like rashes, like vomiting. Yeah. So for these ones, you'll find that once you undergo chemotherapy, you find that these parasites are just invading inside malignant cells. Like okay, let's say those cancer cells, they are inside. So even once you are treating that, they will go inside there and kill the cells. But it's very the possibilities lead to that you're going to see the side effects of that same the same process outside. Maybe let's say you have rashes, maybe you start vomiting, things like that. No, it's very rare that you see such situations under chemotherapeutic agents. But in pharmacodynamic agents, you are definitely going to see the side effects on the patient, most likely on the body of the patient. But for this one, chemotherapeutic, it's very rare that you will see the effects. So that is it about these two pharmacodynamic agents and the chemotherapeutic agents. Then we move to pharmacopoeia. Okay, this one, remember I told you that once you buy drugs, very much important and advisable that cap manual, don't throw it, guys. Don't throw it. It's important. Read through it. Know the chemicals that were used for that drug. I know we are not so much into, okay, it's maybe kite, it's our culture. We are not so much into reading those things. We usually throw them away. But those things are the ones that contain how you are going to use that drug, the side effects of that drug, and also the chemicals that they combined to manufacture that drug, and also the main ingredient of that drug. So now that whole thing now, that paper, that manual is what we call pharmacopoeia. Pharmacopoeia, this is just the official publication containing a list of drugs and medicinal preparations approved for use, their formula and the other information which are needed to prepare a drug, their physical properties, tests for their identity, purity, and potency. So this is what I talked about everything is contained on just that manual. So it's important. Now, that very manual is what we are calling pharmacopoeia. I'm sure that one is clear to everyone. We now move to drug names. We've already talked about a drug. We know what a drug is, and once we ingest it, what it does to our body, what maybe it will have side effects, what will they be, things like that. We've talked about that. So now we need to know the classification of these drugs. Usually, drugs are classified into, okay, generally there are just two classifications. There is chemical and usually brand name, chemical name and brand name. These are just the names of drugs, but you'll find that there will be another one which we are going to call generic name. So that generic name, it just comes from chemical name. So that's why in some other books you'll find that they've just classified the drugs as chemical name and the brand name. But initially, they are also going to talk about generic name. But that generic name just comes from a chemical name. So for the sake of our lecture, let's name this drug in three names. The first one, we are going to talk about chemical name. The second one, we're going to talk about generic name. The third, we're going to talk about the brand name. The brand name is known as a proprietary name. That is the other name that maybe some books they will use proprietary name, and then uh, for the generic they are going to use the word non-proprietary name or drugs, non-proprietary drugs. It depends with the text that you are using. But for the sake of our lecture, maybe we may use both. Am I still audible enough to everyone? I just want to confirm I might remain alone in here, talking and talking. Can't she? People are gone. Am I still audible?
Yes, yes.
Okay. So, chemical name. You remember what we did in organic chemistry last year? So, a chemical name usually just composed of it's just a chemical composition and some molecular structure. Uh, it is assigned according to rules of nomenclature of chemical compounds. This is old data, guys. We did this in first year. The chemical name is assigned according to rules of nomenclature of chemical compounds. Like for example, if we talk of paracetamol, uh, that's a generic name. If we call it as paracetamol, it's a generic name, but it has got a chemical name, and the chemical name will write it as this, which is shown here. Let me just underline it. This one. Some of you went deeper in organic chemistry. I think you know this. It is also known as N4-hydroxyphenyl acetamide. So this one is a chemical name, but we said there is also generic name. The generic name, which is also known as non-proprietary, it is called paracetamol as the generic name, and as N4-hydroxyphenyl ethanamide. It is also known as N4-hydroxyphenyl acetamide. This is a chemical name, and this is a generic name. So that's why I said that a generic name just comes from this one, the chemical name. Generic name simply it comes from a chemical name. So in some text you'll find that they are using they are just saying drug names are two, which is chemical name and brand name. But in this one, we are saying we have three, which is chemical name. We also have uh, uh, generic name, and we also have a brand name. So we are going to differentiate the two, more especially generic and the brand name. Okay, so this is what we've been talking about, the generic name, this one. which is also known as non-proprietary name. So it is the name which is accepted by a competent scientific body or authority, e.g., the United States adopted name. So the generic name is simply derived from chemical name. I talked about this already. It is derived from a chemical name. So what you need to understand is that this generic name, is not matter what company manufactured a drug, but let's say we are using the term paracetamol. Usually, you find that the people who are selling that same drug, let's say pharmacists, let's give an example of pharmacists. Pharmacists will call a drug as a certain drug as paracetamol. Let's give paracetamol as an example. They'll call it as paracetamol. But when a person, what mafia come on, especially people from Chipata, you say to go and buy paracetamol, you'll find that they'll go to a shop and they'll say, therefore panado, therefore panado. And definitely, anyone will know that panado is this drug called paracetamol. It's not a generic name. It's a brand name that's a certain company, came up with to say, okay, we are going to call this drug as Panadol, but the main ingredient is actually it's supposed to be the generic name is supposed to be called as paracetamol, but the people who manufactured that drug they called it as a Panadol to claim ownership. To claim ownership. So Panadol, that name of Panadol we are owners of that same drug called the Panadol. But paracetamol, no one can claim no one will claim that no, this paracetamol is mine. No, 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 because it's non-proprietary name. It's a generic name. That's why even when you are checking that pharmacopoeia, when you are checking it, you'll find that they are going to put the list of things that are there. Maybe there will be paracetamol, there will be what and what, things like that. So that is very much important. Maybe they all just use the same ingredients to manufacture. They might use same ingredients to manufacture a drug, but the names that they're going to call it might differ. It depends with the manufacturer. So that is about the generic name. It comes from a chemical name. That's why it is derived from. So the generic name is the common established name of a drug irrespective of its manufacturer. So like I said, it doesn't matter the manufacturer. Anyone can call it paracetamol. But if you call it Panadol, then the manufacturer will claim ownership of that one because you have used the brand name. So that is the thing we're talking about generic. So maybe you may read this because I think I've already talked about some of these things. Yeah. So trade name. You heard me calling it as a brand name. Brand name. It's the same. There is no difference. You can call it trade name, proprietary name, or you can also call it a brand name. They are one and the same thing. So like I said, the drug as a registered trademark, use of the name restricted by the drug's patent owner, usually the manufacturer. So this one, not everyone can name it as this is the example they've even given here, which is Panadol, and the spelling is this one Tyreno and Panadol. So this one, it's a brand name because not every company can use this name. This one also, Tyreno, it's a brand name because not every company can use this name. But in this same Panadol, there is paracetamol, and everyone can use paracetamol as their ingredient there. But they just can't call it as Panadol because Panadol is a brand name. So by this trade name, there is it is registered it is registered, and the use of the name is restricted only by the owners of that same drug. So that's what we are talking about. I'm sure we are clear on the trade name, generic, and the chemical name. If there is any question, you can ask. We've talked a lot. So if there are people who are behind on the drug names, you can please ask where you are not clear. The silence means everybody is clear, or maybe people are not clear. Which is which? Your response is important.
Doc, kindly repeat on the generic name.
All right. So the generic name, like I said earlier, is just derived from the chemical name. Like I said, this one, paracetamol. Paracetamol is the generic name. Then this one, 4N4-hydroxyphenyl acetamide, it's a chemical name because this one, there is composition and the molecular structure. And I know we understand what they mean by molecular structure. But the other name that you can call this same molecular structure is paracetamol. And this paracetamol, it's what we are calling a generic name. A generic name, everyone can actually use it because it doesn't have, it does not belong to a particular drug. So if we say Panadol, Panadol, if we say Panadol, it's actually a brand name. A certain company just came up with that name to say, okay, this drug, in as much as there is paracetamol, we are going to call it as Panadol to differentiate ourselves from the others. Because this same paracetamol, there are other companies that can actually get this paracetamol with the same maybe composition, and then they are going to call it by other name. It's still going to be, there is still going to be paracetamol in there. So what we are simply saying by generic, this name is just accepted by these two institutions, like the United States adopted name and the British approved name. So it's a name that is just accepted by the scientific or authority as a common name that everyone should be using. But if you want to maybe for the sake of advertisement, that's when now brand names are going to come in to say, okay, we are going to call this one Panadol for us to be different from the others. But what is accepted to the people, like to those people who have, let's say, pharmacists, to the people who produce this same medicine or drugs, calling it paracetamol for easy identification. Because you never find, let's say, where learned people are found, like these scientists, calling paracetamol as Panadol. They're not. What if there are others who doesn't know that brand name? At this paracetamol is Panadol. They're not going to know it. So they've accepted to say there are some words, there are some terms that were going to be used for certain drugs. Take for instance, the same thing we're talking about, paracetamol. It's just whenever you go, if you just say paracetamol, definitely they are going to give you the same. But some of us, we are used with the word Panadol, but its generic name is called paracetamol. I don't know if that is actually clear.
Yeah, it's clear.
Okay, thank you very much. So now let's move to drug classification. Drug classification. So drugs can be classified according to various criteria, and this will include the chemical structure or pharmacological action, the action of a drug, or maybe the content of the drug. In the later classification, drugs may be divided into two main groups as follows. So the data classification, they mean pharmacological action. So for the pharmacological action, these drugs can be classified as chemotherapeutic agents. They can also be divided as pharmacodynamic agents. We mentioned to say for those that are the fast dividing cells or the fast growing cells, we are going to use this one, chemotherapeutic agents, like for the cancerous cells or maybe tumors, we are going to use chemotherapeutic agent. It's very important because this one will kill those cells that are fast growing, like in cancer diseases. Then pharmacodynamic agents, they are used in non-infectious diseases. We all know examples of non-infectious diseases. So that's where now we are going to use pharmacodynamic agents. Like we said earlier, this one, pharmacodynamic agents, you'll find that they'll create the effects, you can see them even on the body, the side effects of those same drugs. But chemotherapeutic agents is very rare that you are going to see the effects on the body of the recipient of that same drugs. Yeah, I'm sure this one is clear. We talked about it earlier. Yeah. Then we move to essential medicine. This is also somehow it's also a classification. So essential medicine, you need to know, like I said earlier, mostly definitions. The WHO gives definitions. So you need to know the definition that has been given by the WHO for essential medicine. Like I said earlier, the definition of a drug has been defined by the WHO, and also this one, the essential medicine, has also been defined by uh, the WHO. So you need to know definition. We need to know the full definition. It's important. It might pop up in one of the essays. Uh, Maybe it can carry 2 marks, things like that, but you need to give the definition that has been defined by the WHO. It's important. So the WHO has defined essential drugs as those that satisfy the priority healthcare needs of the population and are intended to be available within the context of functioning health systems at all times. So let me just summarize it. By essential drugs, they mean, take for instance, mostly 3/4 of the people you hear that my head is paining, things like that. So it's important to have painkillers, like paracetamol. Yeah, it's very much important for let's say a clinic or just in our shops to have for people to have painkillers. It should be easily accessed. So those ones are some of the essential drugs. They are very much important because at any time a person can get sick, and they should get access to those drugs as early as possible. And some of the examples maybe that we can give, epilepsy. There are people who have got that. So those drugs, some of those drugs should be available as they should be available and accessible at any time. Maybe even which one? Okay, I've forgotten some of the examples, but Panadol or paracetamol is the most common example that we can give as essential medicine. Then moving on, we'll talk about orphan drugs. So an orphan drug, these drugs are These are drugs or biological products for diagnosis, treatment, prevention of an orphan disease. So you need to understand and know what an orphan disease is. This orphan disease, these are diseases, very rare diseases. So on those diseases that are rare, that do not easily occur, maybe or that do not usually occur, yeah, in the population, those are what we are calling the orphan diseases. It occurs in those diseases. You are going to give orphan drugs. we are going to give what we call orphan drugs. So these ones are used to diagnose, treat, or prevent an orphan disease. So one example that is that we all know about, because I know we are all medical students and I'm sure we should be familiar with it, is patent ductus arteriosus. This one we can call it as an orphan disease because it does not usually occur in neonates. It does not usually occur. But once it occurs in a neonate, you find that ibuprofen is going to be given, and this ibuprofen, in as much as it is not an orphan drug, if this disease, if this condition, patent ductus arteriosus, occurs, this ibuprofen, once it is given, it is going to act as an orphan drug because it is being administered to an orphan disease, which is patent ductus arteriosus. Some of the examples that you can give apart from ibuprofen are digoxin, immune fab, and also T3. These are some of the orphan drugs. Is that clear to everyone, or maybe we should repeat on orphan drugs?
Maybe we repeat
Is it
about orphan disease or condition. What is orphan disease or condition?
okay? An orphan disease, I said, it's a rare disease. It does not usually occur. So these medicines, orphan drugs, are usually manufactured, though they do not, to the manufacturers, they do not usually, in fact, they do not make profit. They are not profitable because they are rarely produced, and then they are only produced for the, maybe in case, just in case an orphan disease occurred. And an orphan disease is a rare disease. It does not usually occur. So that's what we mean when we say an orphan disease. It does not usually occur. It occurs maybe, let's say, maybe 1 out of 200,000 people. 1 out of 200,000 people. That one we are going to call it an orphan disease because it is rare. It's a rare condition, so to say. Like patent ductus arteriosus. And I know we all remember patent ductus arteriosus. This condition rarely occurs. It's not every baby who is born and then they're going to have patent ductus arteriosus. It's very rare. It's a rare condition. So that's what we mean by orphan disease. I hope that is clear to the one who asked that question about
Yes,
an
it's
orphan disease. Is that
clear.
clear?
Yes.
Okay, thank you. So examples. Now the examples. These are some of the examples for mepizo, ibuprofen, and the T3. These are examples of orphan drugs. So this is also just talking about the same, which I even talked about. Though life-saving drugs for some patients, they are commercially difficult to obtain. So these orphan drugs, they are difficult to obtain. I mentioned to say they are rarely produced by manufacturers because they are not profitable unless the government comes in to say, okay, we are going to pump in money, do this, please. Can you manufacture such a drug? Because in case we have such a condition, otherwise, these orphan drugs, they do not make profits to the manufacturer. They do not give profits to the manufacturers. They are not profitable. Yeah, I hope that is very clear. And this is the end of our introduction to pharmacology. The next topic that we are going to look at is pharmacokinetics. If at all there are people who have got questions on everything that we have discussed today, you can please go ahead and ask. Yeah. If there are no questions, then we are going to call it a night. Do we have people with questions? Do we have people? Okay, looks like we don't have questions. I think we call it a night. Thank you very much to everyone who attended. Next time, we are going to look at pharmacokinetics. That will be our next topic in pharmacology. I think next week, Wednesday. And I'm sure the message was clear in the group. Very soon, we are going to have an online test for Medusa, and it's going to be on Cyrilo Connect. Please find time to create your accounts so that you are clear on that. Sure. I think we call it a night. Thank you very much for attending.